Tips and Tricks for the Allied Health Professional. Episode 6. The Perfect Tube Sequence. A patient has a difficult vein. You get a clean stick, and you quickly pop in whatever tube is closest to your hand just to make sure you get a sample. It feels like a victory. But, drawing tubes out of sequence causes chemical additives to carry over from one tube to the next, potentially invalidating the specimen. Here is what providers and labs do not want to see. Random sampling. Grabbing tubes based on convenience. For example, filling a lavender clotting tube before a blue coagulation tube will completely ruin the patient's blood clotting metrics. The provider receives inaccurate data, and the patient has to endure a painful redraw. Here is the right way, the perfect tube sequence. Memorize this clinical sequence to protect sample integrity. First, blood cultures are drawn using a light yellow tube. However, this is rarely done outside a hospital setting. Second, the light blue tube is used for coagulation studies. Third, serum, which can be drawn in red or gold top tubes, or in a serum separator tube, SST, often called a tiger top. Fourth, heparin testing is done with the light green top tube. Fifth, EDTA, with the lavender top, used to keep blood from clotting for studies on whole blood. Sixth, glucose studies are performed using the gray top tube. To anchor this in your memory, use this mnemonic phrase before you walk into the room. Boys love radiant, girls like grace. That stands for blue, red, green, lavender, gray. Laying out your tubes in the correct order before you poke guarantees a flawless draw. Never insert the needle until your tubes are lined up physically on your tray, from left to right, in the exact correct order. Your challenge today: on your very next blood draw, practice the perfect tube sequence.